My name is Barbara Sattler. I welcome you all to, this is the first in our Nurses Drawdown series that is sponsored by the Alliance of Nurses for Healthy Environments, which is now an international organization of nurses that is dedicated to integrating environmental health into nursing education, practice, research, and policy and advocacy. And the Nurses Drawdown program specifically is a program that a number of nursing organizations have come together to help build. And it's dedicated to drawing down carbon dioxide as well as other greenhouse gases in an attempt to address climate change. And so there are 5 issue areas you can Google. Actually, I'll put all of the websites in the chat so that you can cut and paste them so that you can explore them later. But Nurses Drawdown riffs off of another international program called Project Drawdown. And there's a book called Drawdown that is a wonderful book describing the very many evidence-based ways that we can move towards a more climate safe and healthy planet. And so this first session that we're doing is about moving more towards plant-based diets, not making everybody vegetarians, but moving more towards healthy, sustainably grown and raised plant-based diets. And you also should know that within the Alliance of Nurses for Healthy Environments, there is a Food and Agriculture Committee. If you, and because you're here on this particular session, I'm assuming this is something you're interested in. And if you go to the ANI website and go to the Food and Agriculture page, there's a little line in the middle there where you can sign up and join us, and then you'll hear about the monthly programs that we do on food and agriculture. And so now it's my pleasure to introduce the speakers that we have today. And Megan Edelman is a nurse, a registered nurse with a master's in public health. She has an abiding interest in food and agriculture. She and her husband actually own a company that makes sustainable, healthy foods. And she has been the co-chair of the Food and Agriculture Committee with me. And she's been helping doing, over the last year and a half, these monthly educational programs, many of which are archived on the ANI website. And so we welcome you to go and see those. She's going to be talking about some of the evidence regarding why it is better actually to eat more of a plant-based diet. What is the scientific evidence there? And our next speaker, Stacey Keating, is a faculty member at NYU School of Nursing there. And she teaches in the undergrad program, but is also now preparing an environmental health course for the graduate program. And ANI's education committee has been developing curriculum materials for nurses on environmental health. And I welcome any of you who are faculty members to look at the education site of ANI and look at the e-text, which is an electronic or e-version textbook that the next version of it is going to have a chapter on food and agriculture. The current one doesn't, but the next one is going to have a somewhat comprehensive basic chapter. And what else can I say about Stacey? She's also been involved in global education. And one of the things that we talked about recently is perhaps putting together some global curriculum specifically for environmental health. And this is global nursing curriculum. And our next speaker will be Betsy Skoda, who is with Healthcare Without Harm. And for those of you who are not familiar with Healthcare Without Harm, it is an incredibly wonderful organization that is working on greening our healthcare settings and sector. And they have several spin-off organizations, Green and Global Healthy Hospitals, which is their global arm, Practice Green Health, which is a membership arm. And they have for many years now had a food program. And Betsy is the program manager for their food program, which has done a marvelous job at getting hospital, particularly getting food directors and people involved in food services and purchasing, moving forward on on getting more sustainably grown, local, seasonal, plant-based, check all the boxes for the right foods, organic when possible foods. And I'm eager to hear Betsy's presentation to hear what Healthcare Without Harm is up to. I know you've just got a renewal for another grant and are doing just marvelous work. So I'm going to turn it over now to Megan, who's going to start us off. Each of the speakers will go one after another. They all have PowerPoint. They will be forwarding their own slides. And then at the end, we will entertain Q&A on all the speakers' presentations. So Megan, take it away.
Thank you, Barbara. Just going to take a second, load my slides here. So are you able to see that full screen?
Yes.
Yes. Is that a full screen, not the?
Yes, it looks great.
Okay, great. Thank you. So hi, I'm going to talk about plant-based diets as a means of getting healthy. Again, my name is Meg Edelman. Barb introduced us, so I won't spend too much time there. But today we're going to talk about the connection between chronic disease, otherwise known as diet-related disease, and the many evidence-based interventions to prevent, treat, and even reverse these diseases. This diet actually has a dual benefit because transitioning towards whole foods, plant-based eating not only improves human health, but also offers a frontline solution to the climate crisis. And as nurses are the most trusted source for health information, one key area that was identified for Nurses Drawdown is for nurses to start to come together and advocate for a global transition towards plant-based eating. Today, I'll cover why this is not only critical to improving population health, but helping to alleviate the pressure imposed by the meat industry will also help reduce widespread environmental destruction and loss of biological diversity that results from animal production practices across the world. So we are what we eat, phrase first coined by German philosopher Friedrich Feuerbach. These 5 words hold such absolute truth and been repeated millions of times, driving home the very basic principle that our diet is one of the most significant drivers of our health and our future health outcomes. While there is some agreement about what types of foods constitute a healthy diet, we have really yet to see this knowledge incorporated in policy and practice decisions that, especially around nutrition delivery in our institutional settings. So the negative health effects of diets that are disproportionately higher in animal protein and processed foods have been fleshed out in the research literature, and we now have a rather substantial body of evidence to refer to in support of eating more plant-based. Specifically, we know that animal diets high in animal protein contribute to systemic inflammation, and there's a growing body of evidence suggesting now that they play a role in cognitive decline, mental health disorders in adults, and behavioral disorders in children. The other side of this is that there's a myriad of environmental toxins that our food is now being produced with, which causes a host of other problems, contributing to the development of cancer and damaging the gut microbiome. So this is why this quote is especially important. If we eat 3 meals every day, we have to ensure that we're not only getting the vital nutrients that we need to thrive, but that we're not also introducing a host of potentially harmful chemicals every time we eat that will undermine all our best efforts at being healthy. And I love to start with Wendell Berry, nature writer, poet, and farmer, who said that eating is an agricultural act. And really what he meant is that we all play an integral role in agriculture, whether that's directly or indirectly. The food we eat, how we choose to spend our money will inevitably shape the way the land is managed and dictates whether or not we are really conserving environmental resources. And another one also illustrates this importance of diet in the health continuum. And the food industry and the healthcare industry seemingly profit from us staying unhealthy, and this really does need to change. One way that we can do that is to help shift dietary behaviors to resist these industries' influence. So this is a picture of chronic disease in America. We all know it. It is the inevitable outcome of a poor diet. Chronic metabolic disorders significantly impact the quality of daily life and are often referred to as managing a full-time job. So that job consists of doctor's appointments, medication management, routine testing, and also dietary monitoring. That's just one part. And the other side is the fatigue, increased vulnerability to infection, mental health disorders, attention disorders, and so on. So 6 in 10 adults now have at least one chronic disease, 4 in 10 have 2 or more. The adult obesity rate stands at 42%, 42.4%, and this is the first time the national obesity rate has passed the 40 percentile mark. It just shows further evidence of this country's obesity crisis, and which has increased by 26% since 2008. Today, 1 in 10 people under the age of 50 will be diagnosed with colon cancer. And as individuals, but especially as healthcare professionals, we all have a stake in reducing chronic disease in America in order to ensure a productive and resilient population and create a robust health economy for the future. So the microbiome has a lot of a huge role to play in the development of disease. The microbiome has trillions of organisms, 200 million protein encoded genes. Our gut microbiome is directly involved in immunity and disease prevention, but also directly relates to the microbial environment that we interact with most intimately. Poor dietary choices will alter the healthy balance of the microbiome, ultimately impairing the immune system and predisposing us to a wide variety of chronic metabolic and autoimmune disorders. So this figure illustrates the role of diet and the presence of microorganisms in the gut. And this study specifically suggested that the microbiome of a healthy individual is relatively stable, but that gut microbial dynamics can be influenced by host lifestyle and dietary choices. But this is especially important as it relates to protein and whether or not this protein is derived from plant or animal sources. In this figure, we can really identify that specific bacteria are associated with high levels of inflammation, specifically TMAO, which damages the endothelial lining and is a big contributor to cardiovascular disease. Also, lack of specific gut bacteria is associated with diabetes, cardiovascular disease, inflammatory bowel disease, and systemic inflammation in general. Short chain fatty acids are inherently anti-inflammatory, and they're the hallmarks of a plant-based diet, along with polyphenols, plant sterols, and an abundance of antioxidants from fruits and vegetables that help to fortify the gut barrier and bolster their immune response. So the Mediterranean diet is really the gold standard in the research literature and is highly regarded as a healthy, balanced diet. It boasts a beneficial fatty acid profile that's rich in monounsaturated and polyunsaturated fatty acids, polyphenols, antioxidants, fiber, and so on, which are relatively greater in abundance in vegetable proteins than animal proteins. The Mediterranean diet, obviously, it's a lot of olive oil, fruits, vegetables, cereals, legumes, but it's very minimal to moderate consumption of fish, poultry, and red wine, of course, but a very minimal intake of dairy products, red meat, processed meat, and sweets are really hallmarks of the Mediterranean diet. And it should be noted that the Med diet was really the original plant-based diet. That's how people used to refer to plant-based. More importantly, the aspect of it that's most beneficial is that it's a whole foods diet where processed foods coming in a package with a very long list of unknown ingredients are all but eliminated. and animal protein is significantly minimized. So it's plant-based diets result in better regulation of insulin, a healthy microbiome, and provide optimal nutrients that help to effectively prevent and reverse the pathology that leads to chronic metabolic disorders. So whether it's Mediterranean, vegan, vegetarian, plant-forward, plant-centric, plant-based, the most important part is this idea of reduction or elimination of animal protein, and most importantly, processed foods. So it always is important to make clear that not all plant-based diets are created equal. So as it relates to disease outcomes, this study illustrates it quite nicely as it relates to the incidence of coronary heart disease. And there's a dose-related response with how much a healthy plant-based diet is inversely related to coronary disorders, as well as it's compared to animal on the other side. But essentially what it means is that there's a spectrum of healthy plant-based and not healthy plant-based. A vegan diet that's packed with processed foods is no better essentially than eating animal proteins in abundance, and eating things like substitutions like the Impossible Burger, which seems like a great idea, uses GMO yeast and may not be the answer to the health conundrum. But essentially all of the fad diet foods that you generally find in the center of the grocery store are not necessarily the solution that we're looking for. So we want to be proponents of a healthy whole food, plant-based diet and its benefit to reducing disease. So this is kind of a messy slide, which really just says that just as food is medicine, farming can also be thought of as medicinal and therapeutic. Soil health and human health are inextricably connected, and as you can see from this slide, benefiting one benefits the other. So the way we produce food is just as important to our health as what we choose to eat, and there's growing research comparing the soil microbiome to the human microbiome and sort of this causal relationship that exists there. So you can just see here that this, more carbon means more water, more biodiversity, more beneficial microbes in the soil become more bioavailable to us. Food has greater nutrient density, which contribute, and then we've got the wind and erosion contributing to climate and environmental health there. And climate health and plant health then contributes to human health through diet and environment. We have greater microbial biodiversity to counteract inflammation-based diseases, increase nutrient density in foods, and decrease concentration of pathogens and other resistant organisms. So, and then on top in the red, that's the result of chemical and industrialized farming, which of course do not have a benefit either soil health and or human health. Whoops. Sorry. So the environment really pays the price for our obsession with meat. Animal agriculture is one of the leading causes of deforestation worldwide, and cattle ranching has really been linked to 65% of the deforestation in the Brazilian Amazon. And of course, manure runoff from factory farms is one of the leading causes of water pollution in the United States. So despite the obvious connection between dietary choices and negative health outcomes, a large portion of the population, for a large portion of the population, a meal is simply not complete without animal protein on the plate. It should be noted that factory farms also contribute to air pollution by releasing compounds such as hydrogen sulfide, ammonia, and methane. And this obsession has really increased market demand globally and resulted in intensification practices by the meat industry at the expense of public health. And I recently learned that the demand for meat has stayed really steady in the United States for the last several decades. So the meat that we're producing now is to be shipped abroad to other countries where meat consumption is on the rise. And these are in cultures where traditionally they ate plant foods and had better health outcomes overall. So it's factory farming produces about 97 to 99% of all the meat in the United States. And, so when you're going out to restaurants and eating outside of your home, you're likely eating factory farmed meat. And luckily we kind of are starting to see, we want companies to take responsibility for the environmental destruction that these practices are causing. And Senators Booker and Warren in 2020 proposed a bill, the Farm System Reform Act, to put a ban on factory farms and these monopolistic practices in the industry, and hold these CAFOs, these concentrated animal feeding operations, responsible for their environmental impact. So dietary shifts towards plant-based diets improve human and environmental health concurrently. This focus is on overall diet rather than specific foods. And it means eating foods that are minimally processed, don't come in a package, and are consumed in as close to their natural state as possible, and mostly comprised of plant proteins, fruits, and vegetables. Another thing to consider is that processed foods are largely the product of the big ag machine that I've been talking about, that use these chemical inputs, cause soil erosion, and contribute to widespread climate instability. So eating more plant-based is, could be a significant driver in reducing greenhouse gas emissions, as well as improving human health. So I'm going to go through these rather quickly because we're running out of time, but there's a plethora of research out there that can be tapped into, kind of proving the merits of a plant-forward diet as it relates to obesity and the wide variety of other chronic diseases. This is a systemic review of evidence, including observational and intervention studies, basically comparing the use of a plant-based diet versus the American ADA diet for diabetes. And it found that there were significantly greater reductions in obesity when the plant-based diet was employed. Obviously, there's limitations in all these studies. We need to study more diverse populations and do to further prove this. And again, this is a study that compared a strict vegan diet to the AHA diet, and again, they saw much lower markers of inflammation when a plant-based diet was used as compared to the prescribed AHA diet. And for diabetes, same thing. They used the plant-based diet versus what the ADA diet, and found that beta cell function and insulin resistance was improved. And this was a 16-week clinical trial. And I can send all these references out for you after the presentation, but I'm trying to go through them. I'm trying to condense a 40-minute presentation into 20, so it's a little challenging. And so then this really comes down to whether a food is organic or not. And when it comes to really the necessity of organic food, eating organic to health, this was a study of 68,000 French adults, showed a significant reduction in the risk of cancer among high consumers of organic food. Of course, there's residual confounding here because consumers of organic food tend to have healthier lifestyles overall, but they did show a significantly reduced risk of cancer in this population. And also, again, just generally about really getting optimal health benefit from organic and regenerative farming. This is a comprehensive review that summarizes the evidence on the impact of organic food on human health. And there are really very few human studies that have directly investigated the effects of organic food, but they found that it was an organic food diet was associated with a lower risk of childhood allergies, overweight, obesity, non-Hodgkin's lymphoma, but not for total overall cancer in consumers of organic food. And this is especially important as it relates to prenatal exposure to chemicals and neurological impairments. So eating organic tends to reduce overall risk of autoimmune, obesity, cancer, and neurological disturbances. So organic, plant-based, the combination is really the way forward. So I've just kind of gone through those, and I'd like to share one last document that we created for the Nurses Drawdown initiative, which has the evidence-based rationale, health rationale for, oh gosh, sorry. Somehow it went away. I had it up and loaded. Here it is. Can you see that? Hopefully. So this is a sort of a one-pager that we've designed for Nurses Drawdown for you to use as a reference when you're talking about the health rationale for a plant-based diet. It kind of reviews the science and compiles it together. We are a part of an organization or a coalition called 50 by 40, which is an international multi-organizational effort to help reduce global meat consumption by 50% by 2040. And so our health group kind of compiled the scientific evidence and then compiled it and put it into this sort of one pager. It's actually a 4-pager, 3-pager, but it kind of reviews all the different things that you can use to make the case for transitioning to a plant-based diet. And this you can't see very well, but all of the references for the science that we used to refer to it is in here. So you can dig in more thoroughly at your leisure. So thank you very much. Do we have any questions? I'm going to stop sharing.
Yeah, I think we're going to wait for the questions till the end, if that's okay. And so Stacen, if you want to load, if you're using slides, you want to load your slides now.
Absolutely. Thank you.
And thanks, Megan. Thanks very much.
Yeah, that was excellent, Megan. I learned a lot. Okay. So I think you can, let's see, this looks a little bit different here.
Thank you. That was great.
Yeah, you need to put it in presenter mode.
Yep. So you can see that now?
Perfect. Yes.
Great.
Thanks.
So thank you so much for having me here. I think I'm a little bit, Megan has a lot of information. I learned so much from just listening to her talk. I'm a little bit new to this whole, or maybe a lot new to this field. I've been with ANHI for a couple of years now, but you know, the importance of the environment and climate, I put into NYU where I work, an application for seed funding for an environmental health course, which actually we met about this morning. So we're developing that there. And also I developed things, as Barbara noted, for Nurses International and Next Gen U, which are global institutions trying to scale up and make evidence-based information available to even the most remote, poorest areas of the world. So I started getting very interested in this. I started checking around what's going on at NYU as far as sustainability goes. And so last month, and over the last couple of months, I've uncovered a lot of interesting things that I did not know about. I should give credit to a young woman named Sophie Gollum at NYU who has shared some of her slides with me. She's really the one working in the sustainability office and getting out information on a lot of the initiatives that we're doing at NYU. So 2 initiatives. I knew about the building initiatives. We wanted to reduce emissions by 50% by 2025. We've actually we're really ahead of that goal. So I knew about that. This actually looks like the building that I'm in at NYU on the east side of Manhattan. Because we've been getting rid of water bottles, and we're in a pretty new building that is a green building. So I knew about that effort to decrease carbon emissions. What I did not know about until very recently is on the right side, that we really have a strong initiative to reduce food-related emissions 25% by 2030. And so that's what I'd like to kind of talk about. It's very interesting to me, this the work that's going on that I don't think a lot of people know about actually at NYU, but I think it's very relatable to the nursing students that I encounter. And so, that's kind of where I am going to focus. So why food? Global food systems account for about 1/3 to 1/4 of greenhouse gas emissions. And as Meg noted, animal-based products have a much bigger impact on greenhouse gas emissions compared to, our plant-based diets. NYU, is engaged in this effort to kind of improve the foods that are available to students, faculty, and staff at NYU. NYU is a very large, probably the largest private university in the United States. We have degree granting campuses also in New York, Abu Dhabi, and Shanghai. We also operate 11 global academic centers. So we're a very large operation. We're affiliated with NYU Langone across the street. We're in a medical corridor. That's a huge hospital system, and it's just been growing. And we also have, we are also involved with New York City Health and Hospitals, so another huge organization. So we have a very big reach. We train many, many nurses each year. We have 2 cohorts of nurses. So we're training about 500 plus undergraduates, plus we have our graduate DNP and PhD programs. This was something that was interesting to me that Sophie Gollum brought to the class. She came and spoke to my nursing, public health nursing class at the end of March. I don't know if you can see this. I hope, maybe a little difficult to see, but I threw out a poll to the students in my class. We went through all of this talking about, the emissions that occur because of beef, lamb production, chicken. So you can see here on this diagram that obviously the meat-based food products create a lot more emissions. And then you come down to like fruits and apples, root vegetables that create very little. When I threw out the poll to my students in the class, after we had this discussion, 90% of students in the class were unaware of this. So I thought it was a very good thing to bring to the students. They're getting ready to graduate. They're in a community class. They're doing health education presentations. They're assessing populations and trying to make impacts in their community. So, going forward, I hope to really capitalize on this more with students, because I think this is a great contribution that students can make out in our communities. We have many communities that are food insecure. They don't have access to a lot of more healthy foods. So having students start to kind of dig deeper into that and see where the needs are, I think is a really good kind of direction to go in. So this is, can healthy foods save the planet? Students, I don't think, are used to seeing this particular plate. So it's very important for them to get the sense of where their patients should be choosing their diets from. We know that we don't offer a nutrition class. We think probably in nursing programs that we do know about nutrition, but I have a feeling that students are not aware of really how to counsel patients, get into the nitty gritty, take a 24 to 48-hour diet recall for patients, really assess, where they're eating, what kinds of foods, and counseling them, either individually, patients that they encounter in the hospital, or, based on populations that they encounter in a course like community health. The Cool Food Pledge is the thing that was really new to me. I did not realize that we were taking part in this. New York University has signed on to the Cool Food Pledge. The goal of this group of organizations is to really reduce greenhouse gases that are related to food on campuses by 25% by the year 2030. And the NYU dining halls are shifting to more sustainable food products. They're focused on plant-based offerings. So students aren't really aware that we're starting to integrate, and I think it's going to be a 10-year process, and NYU has a very big reach. There's over 40,000 students there. There's over 19 or 20,000 employees there, plus all the hospitals and clinics and things that are around us. So we have a very large reach and the ability to educate and impact a lot of people. But these dining halls over time are shifting to more sustainable food products. They're trying to focus on the plant-based offerings since those are much healthier. So NYU is joining this Cool Food Pledge is part of over 30 other organizations. And it's estimated that these organizations together as a whole impact about 800 million meals served. So this is a very kind of ambitious sustainability related goal for NYU. The implications for nursing, I think, are vast. And I think Meg actually did a great job talking about chronic illness and how, when we educate our nurses and when those nurses go and educate their communities and educate the patients that they care for, there's the ability to have these multiple impacts. So not only, choosing foods that are more sustainable, will that impact climate health, right, for currently and for future generations, but it has this big, robust ability to impact the health of our individual patients, our patients with hypertension, diabetes, obesity, and other things. I can easily see how this could be so beneficial to integrate in so many of our clinical courses, because if you look at students taking care of moms and babies, maternal child health, pediatrics. At NYU, we have 3 levels of med-surg courses, plus we have our public health and community course. So you can really see how having this knowledge and this information can really start at very early stages of life when we're educating moms and babies and their children, all the way to older adults who have chronic illness and who suffer for that reduced quality of life, the need to be on many medications, and all the health effects, side effects, and expenses of that. Lastly,
Oh, go ahead. Is this the last slide? I was going
this is
to
the very last slide, and I just wanted, this is Earth Month. If anyone is interested, we are running next week. There's going to be Healthy Hospitals, Healthy Planet information coming up on April 22, Climate Connections on April 23rd. And we do know that actually this does bubble up from our nurses in the class. They are very interested in understanding and making change within hospitals because they see the level of waste and they see what the patients are eating every day when their food tray comes. So there's just a little link to our NYU information. And I want to thank you for having me here.
Yes, thank you so much. It's nice
Thank you.
just know about the practicalities of things that you can do. And Betsy, can I ask that you share your slides And one thing that I just want to mention, I put a list of the resources. The links did not follow, so there are no links, but I've asked Katie if she could cut and paste. I sent them to her in an email, so hopefully you'll get the links in the chat. Look for those. And Betsy, you are on.
Just needed to unmute myself. So hello, it's really nice to be here today and to hear these other presentations. I'm excited to hear about NYU's work. We actually work with NYU in our programming, both in our food programming and beyond. So it's great to hear about what's happening in the on the university side. So today I'm hoping to share or increase your knowledge of the connections between food systems, environmental health, and the public's health, building on what the previous presenters have done. You share strategies that hospitals are using to increase healthy and sustainable foods on campus, describe the roles that clinicians can play in these efforts, and then hopefully identify some programs that we have and resources that will be of use to you as you consider your role in this work. So before delving into that, I just wanted to give you a little background on our organization. So Healthcare Without Harm was founded on the belief that as the only sector with healing as its mission, healthcare has an opportunity to use its ethical, economic, and political influence to create ecologically sustainable and equitable and healthy communities. So our organization was founded over 20 years ago and seeks to transform healthcare worldwide to reduce its environmental footprint, become a community anchor for sustainability, and a leader in the global movement for environmental health and justice. And we do this through conducting research, modeling strategic interventions, and providing guidance and resources that aim to spread and accelerate best practice in the field. And so our food program is one of the areas, food is one of the areas in which we work. We have programs focused on climate and health, safer chemicals, and also other areas. We also have a membership organization called Practice Green Health, which is the leading membership and networking organization for sustainable healthcare, and aims to deliver environmental solutions to hospitals and health systems across the US. So the Healthy Food and Healthcare Program was established in 2005 and works to harness the expertise and purchasing power and investments of the healthcare sector to advance development of a sustainable food system. So we know that hospitals are very influential institutions in their communities and can influence social, economic, and environmental determinants of health. And through their procurement in particular, hospitals have this opportunity to enhance sustainability, equity, and health in the way that food is produced, processed, distributed, and consumed. So we work, the Healthy Food and Healthcare Program works predominantly in the US. We have innovation hubs across the country in California, New England, the Pacific Northwest, and the Southwest. And then we also do discrete projects in other areas. And we try to model strategies and create tools and resources for healthcare facilities and clinicians to influence the shape of the food that they serve on campus, as well as what's happening in their communities. And what we do is we model these programs in these innovation hub regions, and then we scale them to national campaigns and through Practice Green Health. And we currently have a network of over 1,000 hospitals who are engaged in healthy food strategies. And we also, as part of our work, try to benchmark and report on sector progress to really build this community of practice. So as you've heard from the other speakers, our food system isn't working so well. And we try and talk with the hospitals and educate them kind of on the process of, or the issues along the supply chain. So from the way it's produced, processed, transported, made available for consumption and consumed, and how the different practices impact environmental, public, and individual health. And also raise that there are opportunities along this chain to support the health of workers, eaters, and the biological systems on which our health depends. So you've heard about diet-related disease. Food insecurity is another huge issue in our country. It was an issue before COVID, and COVID exacerbated food access for, really across the country, but specifically for specific populations more so than others. And our agricultural system creates these risks for workers We have these issues of antibiotic resistance in animal agriculture. I recently read a report about the use of streptomycin in citrus production, which is really frightening to think about the impact both on workers and the need for this therapeutically important drug being used in agriculture production and putting it at risk for when we need it to treat illness. So what would a healthy, sustainable, and equitable food system look like? So there are many opportunities for strengthening the food system to support human health and also create greater resilience. And this resilience will be important as we face future disruptions related to climate change or other issues. And these opportunities include increasing healthy food access, localizing the food economy, reducing agricultural's impact on natural systems, and also improving policy to promote food system sustainability and equity. And with these opportunities, and a really important point is that they can be stacked for greater cumulative impact. So when we're working to create healthy food, working with hospitals around their healthy food access programs on campus, we may also be connecting with their community benefit people to talk about how they can support healthy food access and localized food systems in their community. And all around this creates more positive benefits of the localized production makes it easier for people to access food. With more local agriculture, there's a multiplier effect as small and mid-sized farms tend to spend the money that they earn in their communities, they're creating jobs. And so there's a positive reinforcement within the rural economy, rural environments where these farms are located. So there are distinct opportunities for health and healthcare professionals to engage in improving food systems and food environments, both on campus and in the community. And some of the strategies that we work on include, helping hospitals and health systems use their food service purchasing to support more regionalized and sustainable food production. So the way that hospitals purchase food, they're very well positioned to influence markets. Many of them purchase through large group purchasing organizations. So there are opportunities to start these conversations with their purchasing agents and major companies about how they can incorporate more local and sustainable foods. They also, can purchase directly from local farms and build these relationships with their community members. And in some cases, hospitals are even starting to grow food on campus. So the image in the corner there is Boston Medical Center, which put in a rooftop garden. It's 7,500 square feet. And the food that is produced there goes into their teaching kitchen, which is a community-focused education, patient and community-focused education. It goes into their on-site food pantry, and it also gets, some of it also goes into their food service. And this, this on-site production actually addresses both food and sustainability. As a rooftop garden, it's aligned with their sustainability initiatives and reduction in energy use and emissions. So improving campus food environments to be healthy by default is another area. So this means looking at behavioral design. How are items placed in cafeterias? What sort of signage is used? And what opportunities are there to elevate healthy and sustainable options and make it the easy choice? And then we also support food service operations to address food waste reduction through either composting efforts or recovering food for donation. In a little bit, I'll share about a project that we did in California recently that aimed to connect excess food and food donations in 2020. And so the next few slides, I'll share examples of the work that we have done with our partners. So as I mentioned, hospital food service purchasing is a really important and direct strategy that a hospital can use to improve the food available on its campus and to support regional food economies and more sustainable production. And several recent initiatives have demonstrated the power of institutional collaboration on purchasing initiatives and have led us to develop tools and resources to support other hospitals and their partners on collaborations. So the first example is ProcureWorks. So this is a model that's currently being worked on in California and Oregon, and it's bringing together hospitals and public schools to identify products that they can, agree to purchase from local sustainable producers, and then work together to create pathways. And this approach is taken because often, they're trying to buy. They might both use Sodexo as their food service management company. So if they can agree on particular products, they can work with Sodexo then to determine, the sources and help those producers become approved vendors, which makes it easier for them to purchase the products. Another project that we did recently was Nourished by New England. This is a project that I worked on with two colleagues in New England, and it focused on building purchasing pathways for hospitals and local growers. And so we had two parts. One was a seasonal harvest campaign, where we worked with a set of advisors to choose 16 products that were featured across the year. There were 3 fruit or vegetable products and 1 seafood item, since we are in New England. And we wanted to highlight the availability of underutilized species that are landed in New England. And we created a set of promotional materials that hospitals, hospitals who participated signed up and had access to these materials free of charge. And what we tried to do was highlight both that these products were from New England and kind of give fun facts about the history of production in New England or the amount of production in New England. We also paired it with information about nutrient content, because we were hearing from hospitals that that was something they were trying to promote to their customers. And so the other piece of this was working with a set of farm and food businesses to help them scale up to serve hospitals more, because in our work with hospitals and with community-based and regional organizations, we talk to farmers a lot. We do a fair amount of research, and one of the things we've heard in our research is that there's greater capacity to grow food in New England. And one of the reasons that farmers can't scale up or are concerned about scaling up is that it means they have to assume risk if they don't have a commitment in place. So we've, over the last few years in particular, really tried to bridge this gap and bring together producers and institutions to try and start these conversations about how they can work together to plan in advance of the production season, because it helps the farmers, of course, not assume this risk. And the institutions actually are benefit as well, because they're planning their menus anyways, and they can be thinking about how to incorporate these ingredients, and they'll know when they can get them. And this process involves trying to come to an agreement on quantity as well as price. So it kind of helps them along the way. And we've seen great success with this in New England with the University of Vermont Medical Center, who's for many years engaged in this type of planning. And it's allowed them to, for instance, secure local poultry that they were hoping to secure by working with a farmer to actually purchase the chicks that were then raised for UVM Medical Center. In another case, they were able to help a farmer scale up and create or build a hoop house that would allow them to produce the greens that they needed for their salad bar. So there are lots of opportunities for relationship building. And these types of projects that we do, we produce resources and case studies that are available on our website. So another recent project is the Blended Burger Project, which elevated the opportunity for creating a delicious meal with less meat. And one of the things that we try to work with hospitals on is, with their food service, particularly their retail, facing their cafeteria, they need to meet their customers' needs. So how can we help them meet their customers where they are? And the Blended Burger Project came up as an opportunity to try and do that. So the blended burger is an idea that's really been developed through the Culinary Institute of America and the Mushroom Council. And so what we did in New England was we worked with a set of facilities that were interested in trying this out and serving this product. Some of them were able to purchase an actual blended product from a local purveyor. Others did the blending on site. And the goal was to reduce the meat in the diet and support less sodium and fat consumption, while also addressing the greenhouse gas emission portion and environmental impacts of livestock production. And so we worked with these facilities. We provided this poster that talked about the Blended Burger Project, and there was great success. People, they really liked the burger. They didn't notice the difference. And this actually, this strategy was then employed in our Nourished by New England program. Two of the farm and food businesses involved, one was a mushroom producer and one produced pork, and they came together and developed a blended sausage product that then they were bringing to market. And the blending can be done. Well, we have done this work with mushrooms. There's lots of opportunity for blending, meat and lentils and different portions. And it's also, our hospitals like that it's an opportunity for them to be creative as well. So more recently, we've launched this Plant Forward Future effort. And so the Plant Forward Future really tries to wed regional sourcing with plant-based eating explicitly. And we know that, as Barbara mentioned earlier, with Project Drawdown, shifting plant-rich diets globally could save $1 trillion in annual healthcare costs and lost productivity. But beyond that, we also know that plant-based proteins and plant-forward eating is in demand. So the National Restaurant Association's 2020 What's Hot survey found that plant-based proteins were #2 on a top 10 list. 44% of consumers have reported trying to increase their intake of plant-based proteins like beans and nuts. And millennials in particular are eating a lot more meat alternatives than previous generations. And healthcare facilities can increase their food sales and attract new customers by aligning their food service with these trends. So as part of this project, we are working with cohorts of 3 to 5 hospitals in each of our innovation regions. And we're working with these hospitals to identify products of interest, to identify how we can support them purchasing products, and also conducting consumer surveys to better understand actually what the preferences of their customers are. And part of the products of interest piece is looking for opportunities to create value-added products. So one of the things that's happening in New England is working with a yellow pea producer who's based in Maine to develop some sort of maybe vegetable fritter or something that includes yellow peas as an ingredient. And we're hoping through this process, we're also working to build those relationships between the processors and the producers, around the advanced planning, and then again, producing a set of marketing materials so hospitals can promote what they're doing to their customers and the benefits of this plant-based eating. And we've also done for the last few years a healthcare culinary contest, which is aimed to elevate the opportunities for plant-based eating. And last year we actually focused on comfort foods, and we have a wonderful set of recipes that have come in related to, actually NYU was one of our finalists this past culinary contest. Really creative ideas for how to integrate more beans, legumes, and whole grains. And the idea is it's very focused on whole foods, not we actually don't allow for meat analogs or anything like that. So you heard briefly about the Cool Food Pledge earlier, but Healthcare Without Harm is actually involved in this project. We provide technical assistance to hospitals, and we support them in collecting baseline data on their food-related emissions, helping them plan for strategic purchasing. And also this program has great resources available around marketing, because that really is how you market and describe your food really makes a difference to consumers and can attract them to new offerings. And then there are also these great opportunities to connect what's happening on campus and off campus. So last year we had a pilot in California with a number of facilities around a food donation program. And it was really about making sure food that was usable did not end up in a landfill where it's contributing to climate change, but instead went to communities and organizations that could use it to feed families. And then also in the community, you know, there's great opportunity to work with hospitals as anchor institutions to, you know, harness their economic power and resources to change the social and environmental determinants of health. Healthcare Without Home previously was engaged in research on how to improve community food environments. And as part of that research, there's, you know, there are several roles that clinicians can play in this work. So we have a suite of resources that talk about different strategies, such as fruit and vegetable prescription programs, you know, farmers markets, and different types of community education. But there are also there's also resources about the roles that hospitals can play. So it could be that they are hosting a summer meal site, or participate, you know, sending staff to participate in a school wellness program. And being part of those conversations can really help spread information about the opportunities for healthy and sustainable eating.
Betsy, are you about to wrap? Is this your last slide too?
It is my last slide.
Okay, thank you. Sorry.
No, that's fine. So, you know, to close, I just wanted to, you know, share these opportunities for some ideas for how you could get involved in supporting your healthy food and healthcare work. And I would encourage you to, you know, visit our website, and I have my contact information here. I'm happy to answer any questions, or you know, direct you to my colleagues who might also be able to answer questions. Thank you.
Thank you. Oh, Betsy, thank you so much. Betsy, Stacen, and Megan, together you did just an absolutely awesome job, and in 1 hour packed a lot of information. And I see that we unfortunately are out of time. I want to just quickly answer one question that showed up in the chat about organic foods from somebody from Canada. And in the US, the USDA, if on the food product it says USDA certified organic, there actually is a fairly rigorous set of hoops that you have to go through to have your product be certified. There's no perfect system, but that one works pretty well. And as an owner of a USDA certified organic farm, I can say that there is accountability that you have to make as a producer of foods. So I'm going to have to cut it off now, and regrettably, I think that maybe Stacen, if you want to put your email, if you're comfortable, so that people can follow up with you. Betsy has given her information. Once again, if you go on to the Annie website and go to the Food and Agriculture Committee, if this is an area that you're interested in, we're going to be spending a lot of time this next year really delving into the practicalities of how we can make real the needed changes that we have to make in our food and agriculture system. So it was great having so many of you join us today. I hope you learned as much as I did, because I learned a lot. And really fabulous speakers. Betsy, Stacen, Megan, thank you so much. So appreciate it. And everybody have a good, healthy, and sustainable day today. Bye now.
Thank you. Thank you. Thank you.
Bye.
Bye.